Hello friends, as we know that psoriasis is a chronic lifelong disorder and it is a skin disorder. But there are a number of other skin disorders, they are also lifelong. For example, there is lichen planus, there is eczema, there is vitiligo. So these are the main common disorders of skin that are there for lifetime. So what is the difference of a psoriasis in relation to all these disorders? For example, if I say the psoriasis is the most severe culprit, because although psoriasis is a skin disease and it begins on the skin, but over the period of time it doesn't remain on the skin. It goes on affecting and increasing. Even if it begins as a small symptom, as a dandruff on the scalp, gradually it will spread all over the body, on your palms, on your soles, on nails, and in 50% of the patient, it can cause psoriatic arthritis, which is one of the most debilitating joint disease, whereby the other disorders of skin, which are also chronic. So let us talk about them and the difference. For example, if it is a vitiligo, that is, there is no melanin or there is no skin color in your skin and you become completely white. That is what called as a vitiligo. So in case of vitiligo, there is no internal disorder or there is no change in your apparently healthy. Only one condition is that it is disfiguring and it appears, whereby the skin has no, but one can lead a healthy life and it is also not contagious. Another disease, let us talk about the eczema. Eczema is also there. Rarely eczema affects all of the body, but usually it is on the small parts, legs and hands or like that. And it usually remains localized, and by the treatment of eczema, it does not spread to the internal organs or it does not cause psoriatic arthritis or any other disorders. So this is one of the benefit, or it is less severe than that of psoriasis. Then there is a chronic disorder called as a rheumatoid arthritis, that is the disease of joints, which is an autoimmune disorder. But it is the same like that of psoriatic arthritis, but it is limited to the joints. Last but not least, one has to be very careful about psoriasis, especially psoriasis. In psoriasis, since it is an autoimmune disorder, we call it a disease complex. Or many a times, all these diabetes, hypertension, and heart disorders, they come together and they form a complex skin disease, which many a times causes a life-threatening to the patient. Moreover, psoriasis patients have more tendency for the diabetes, that is double tendency to the diabetes, hypertension and cardiac disorders than a normal person. So one has to take care of psoriasis, whereby all the disorders that I mentioned, that is leukodema, that is vitiligo or eczema, so there it is not so. So in that relation I say that psoriasis is really a most complicated and a disease that will lead to complications. So one has to be very aware and particular in treating psoriasis. One should never neglect the psoriasis treatment or not allow the psoriasis to become severe.